In this talk, we'll cover issues related to the engagement of clients, both voluntary and non-voluntary, and also the use of your relationship in working with them. When you talk about resistance with clients, a lot of times we assume that the resistance has to do with their unwillingness to engage in the work that has to be done in order to bring about change, when oftentimes it isn't so much about the actual process of working together, but it is really a resistance related to the possible outcomes if your work together is successful. This is called outcome resistance, and it refers to the benefits of the current behaviors which may outweigh the cost of the behaviors in that person's everyday life. So any analysis about any outcome in treatment sometimes shows that there are more costs than there are benefits if the client achieves a goal. For instance, stopping the use of drugs. While there are many benefits from doing that, that also involves the loss of friendships. It involves the loss of a routine. It involves the loss of coping mechanisms, involves the loss of relaxation, and so on. And so it's very useful early on in contact with your client to explore those areas. What is it that the client will be giving up in making the changes that are necessary? And this might help you anticipate the level of participation that you can expect. Obviously, this is more of a problem with involuntary clients, but it's also an issue with voluntary clients as well, who oftentimes don't understand or don't recognize the changes that are going to be necessary if treatment is successful. Change itself is hard and it requires a lot of work and effort, and sometimes it also involves dealing with pain that hasn't been dealt with before. This is one of the things about the process of therapy sometimes, is uncovering things that clients have been keeping from themselves, and it's difficult sometimes to work through those things and to deal with the pain and the feelings that have been covered up for years. Clients might be reluctant to change because of the problems that giving up behaviors cause for themselves, and also the problems that it might cause for others. And that's another area worthy of your investigation, is how individuals in the client's immediate family or in the immediate interactions on a day-to-day basis might react to those changes, and whether they're going to be supportive or not of the changes that are coming up. Poor relationship skills, damaged past relationships, those kinds of things are all factors also which can intrude on the relationship that the client establishes with you as a worker and can make engagement difficult. When there is resistance, rather than just to write it off and say you can't do anything with a person because they're too resistant, instead explore for reasons for that and look for ways to overcome those barriers. Empathize. Don't try to persuade or analyze or use logic in trying to engage the resistant client. Early in the intervention in particular, personal and social factors such as this can influence their participation. You can encourage participation by emphasizing the benefits of the change that is to come. And again, this is going to be something you have to look for, the benefits that the client can recognize and that the client values as well. And then, of course, when desired behaviors occur during the course of treatment, you want to prompt and support those behaviors as well. And make sure that there are those in the client's environment outside of your office that also supports and prompts the desired behaviors. The participation of the client comes from, in part, your skill in encouraging the client to believe that the methods that are going to be used are effective. Remember, we talked about this a little earlier, I believe, that creating the expectation of success is something which really helps to breed success in this interaction. Focus on outcomes that are important to the client. Sometimes in an immediate sense, try to find a way to be helpful. Are there concrete services that you can provide that might help hook the client into the relationship with you? Are there things you can do to help reduce the stress that's related to the changes that are going to be required? All those kinds of things are things that in a very immediate sense you can do to help the client engage. And we should anticipate hesitation a lot of times, and in a certain extent prepare for it. Anticipate hesitation about the likelihood of change. The clients oftentimes will have doubts that therapy will be beneficial, or again, fears about what will happen once those changes occurs. There'd be concerns about confidentiality, how long it's going to take, how much effort is going to be involved, what are the costs associated with it, whether or not the client's going to be judged positively or not with the changes that occur, or because the client is in treatment, and maybe some doubts about the differences between you and the client as well, and whether or not working together is going to be a successful venture. All these things contribute to the hesitation on the client's part and might be something that you prepared for in anticipating and beginning the treatment relationship. Be aware of differences in social class. This is another thing that sometimes can intrude, in cultural differences as well. We have you looking at the stages of change model. in material in the weeks surrounding this particular lecture, and you want to assess where the client is at in those stages of change and intervene with that in mind, because there will be different things you might want to do depending upon whether the client is in pre-contemplation, contemplation, or actively ready to begin to make those changes. Always focus on the client's strengths and finding ways to utilize them. And if there is a coercive nature to the relationship, as there often is, talk about that openly, acknowledge it, and help the client deal with whatever hesitation they may have in interacting with you because of that. There are those who say that helpers reinforce some behaviors, ignore some behaviors, and punish others. And in turn, clients influence the helper's behavior as well. It is a mutual interaction, and it is a give and take in that relationship. So the quality of your communication skills influences the attitudes and behaviors of the client. And be aware of the fact that some of what you do may not be facilitative of change. Your effective relationship skills require that you communicate respect and understanding, even in the face of criticism or anger coming from the clients. And doing that, being able to keep your equanimity through all of that is something that will add to your effectiveness in the client's eyes. We have been talking about the discussion and the debate, and you've been reading about the debate about whether non-specific factors or specific interventions are more important in the treatment relationship. And again, these points show you that research shows that the non-professionals, that is paraprofessionals, are often as effective as those who have professional degrees, training, and experience in helping clients. The authors have quoted Wampold in studies earlier in the century that says that a preponderance of evidence indicates that there are large therapist effects and that the effects greatly exceed treatment efforts. That is, the effects that depend more upon the therapist rather than the intervention used in many cases. And there are other studies that are cited that say that the therapeutic relationship variables correlate more highly with client outcome than do specialized treatment techniques. Again, this points to the importance of your approach and your relationship with your client. Some of the variables that are said to have a positive impact on outcome in your treatment with individuals is your credibility, your ability to display and make use of empathy in your interactions with the client, whether or not you are affirming of the client, your skill in engaging the client, some of those factors we just talked about, how well you're able to keep your focus on client concerns throughout your interaction, and your skill in directing client attention to his or her feelings. These are things that oftentimes have a very positive impact on outcome. So one of the things you want to be able to do is to be sure you listen well, that you're physically and mentally ready to listen, and also that you wait for others to complete their statements before speaking. Don't cut your clients off. Don't tell them you already know what they're going to say, but allow them to complete their thoughts before you begin to move on in what you're thinking. This is something that's pretty basic communication skills, of course. They talk about here the assumption of ignorance, and this is something that I wanted to mention to you, that sometimes your ability to listen and listen well, and for your client to feel they're being heard, is for you to take the role of not understanding, not necessarily not understanding, but not being aware of or sure of what the client is saying, that you have some ignorance about the topic, and so ask them to clarify and expand upon what it is that they're explaining to you or telling you about. Your nonverbals, of course, are very important, and is your body language and your facial expression and your body position and all that. We'll touch on that in a few slides further. I was taught in my bachelor's training very early on to avoid advice giving. And in fact, I had one instructor who said he was going to come and look us up if he ever heard from one of our clients that we were giving them advice. Because even though they may be asking for advice is not what you want to give you, because it really fosters dependence upon you, establishes you as an expert, as somebody who knows better than the client, and you want to be able to help the client find the answers within themselves, essentially. Avoid responding to clients and things that they say with cliches, patronizing responses. Avoid parroting, that is where you repeat back the exact words that another person says. That's not empathy, that's not paraphrasing, and it's really generally not at all helpful in the communication process. If you don't understand, be sure you tell your client that. And again, that's a part of the assumption of ignorance. But don't pretend that you understand when you don't. This is another thing we're going to touch on in a few slides, but interpretation of feelings, which is something you should be doing in the course of your work with clients. If it's timed poorly, if it's too early in the relationship, can really backfire on you. So listen sometimes instead of trying to interpret. Just listen. Sometimes that's the most powerful thing you can do. Watch your mannerisms that can be very distracting, like repetitious responses. Okay, 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 type of thing. Or repetitious behaviors like nodding your head or gesturing with your hands over and over again. Mixing paraphrasing content, now that's not parroting, but paraphrasing where you're using your own words while reflecting feelings may be among the most effective responses you can use in interactions with clients. There'll be more about that in a few slides. There are things you can do when you question that are more helpful than others, and questions direct attention to the things that you believe is important. Questions sometimes can progress from open-ended to be more specific, close-ended questions when necessary. The best questions that you can ask in general are open-ended questions which allow for a wide variety of responses on the client's part, and not closed-ended questions which draw out a yes or no answer or one-word answers. Questions should always have a purpose that contribute to helping the client. That is, they should be instrumental. Avoid the kinds of errors in questioning that are listed here, like leading questions, where you really are kind of pointing the client to the answer that you want. Asking questions at the wrong time. Again, this should be timed carefully. Avoiding closed-ended questions. There are times when you'll have to ask closed-ended questions, but the fewer times that you have to use closed-ended questions, the better. Don't ask questions that don't have any meaning or point to the content. Don't ask more than one question at a time. Keep your questions simple. Don't ask why. There are alternatives to how you word things that avoid that word why, which tends to have a blaming kind of exasperation implied in the question. And don't suggest answers with your questions. Again, that's essentially leading the client to answer your questions the way you want them answered. Probes are a good alternative to asking direct questions if you have ambiguities that need to be clarified. So instead of saying, why did something happen, you might just say, could you tell me more about whatever it is? And that opens the door for greater elaboration on the client's part. Confrontation can be very negative if it's used at the wrong time or if it's used too forcefully in situations where the client isn't ready to receive that kind of interaction with you. Confrontation doesn't have to be done with a jackhammer. Confrontation can be done professionally and with sensitivity for the client's feelings. What this will do is to help the client increase awareness of the discrepancies in what they do, think, and feel. If you become adept in the motivational interviewing technique, this is one of the things that can be very useful, this skill, in helping the client move along the stages of change and to be ready to take the steps needed to bring necessary changes to their life. So while it implies conflict and negative impact, that negative feedback will decrease risk-taking and performance, so you have to be cautious about its use. Avoid lecturing, teaching, and criticizing with your confrontation because this is only going to increase client resistance. And carry confrontation out in a manner that minimizes the likelihood of defensive reactions. Remember the thing that I keep saying over and over again when I talk about communicating around difficult subjects with each other. The message that you send should be the same thing as the message that the other person receives. And it's your responsibility as the sender of the message to make sure that it's conveyed in a way that the other person can hear it correctly. So you don't want to create a lot of defensive reactions in the other person when you're going through a confrontational style of interaction with them, because rather than listening to you and hearing what you're saying, they'll be too busy thinking up defenses and denials to your confrontation. It is possible to be firm but supportive at the same time. It's a skill, but it is possible to develop. Timing, of course, is very important. You should always consider the client's readiness for the confrontation, if at all possible. There may be some times when you can't wait, but if at all possible, you should be sure that confrontation is brought across at a time when the client's ready to receive it. And there are some roles that you're going to have in your career that will require its effective use with some routine. And, child protection, for instance, is a good example of that in those types of roles, or in corrections and so on. And so being reluctant to use it when it really needs to be used can be destructive and very counterproductive at times. So keep that as a skill in your toolbox, so to speak, but just use it properly and wisely. Again, with the interpretations, and this pops up a few times in these slides, I know, but don't use interpretations more often than you need to, nor should you use them prematurely. Interpretations can imply that you know the real meaning of things that the client doesn't know. It's just something that is very effective when it's used properly. Again, we'll talk about that in a few moments, but don't overuse interpretations. Don't, essentially telling people how they feel about things when it isn't really going to be beneficial to them. What about self-disclosure? This is something we've also talked about, and it can be helpful in encouraging clients to share information in that you're showing some similarity with the client perhaps, or seeming to be less aloof in your relationship with the client. And sometimes answering questions about yourself is very, very helpful in normalizing concerns the clients have about their own lives. So they might ask you to disclose to allay the concerns that they have, or maybe to feel closer to you. And it's something that you should probably be aware of and try to be sure you know what the reasons are for the probing that the clients are doing in their relationship with you. If you, for whatever reason, decide that it's not appropriate to self-disclose at the time, or the level of questioning and the level of disclosure is inappropriate on a client's part, don't be brusque in your declining to self-disclose. Don't throw the questions back to the client in a condescending manner. And also keep your answers, whatever answer it is, focused upon content that will contribute to service goals and not something that will deflect from the service goals. And that is another reason sometimes why clients might ask about you, is to kind of take attention away from themselves. So while too little disclosure kind of keeps a distance in the relationship, too much disclosure can create embarrassment on your part, or reluctant disclosures by the client. Meanwhile, sharing personal experiences can encourage a positive relationship if it conveys an understanding of the client's circumstances or helps the client see new ways of understanding things. But if the self-disclosures are not related to service goals, then they're probably not appropriate. And might be a reflection more of the worker's need for approval by the client than it is something that will aid the therapeutic process. So always keep boundaries in mind when considering these things, and always consider cultural considerations in both your own self-disclosure as well as the expectations of others' self-disclosures. We'll talk a little bit about the core conditions again, and these are all familiar topics to you by now, but it's just useful to go over again. And the three core conditions, and in one way or another, this all goes back to Carl Rogers and his client-centered therapy techniques. The three core conditions are empathy, non-possessive warmth or respect, that is unconditional positive regard in another way of putting it, and authenticity or genuineness. Empathy is the sensitive ability and willingness to understand the client's thoughts, feelings, and struggles from the client's point of view. And there are different levels of empathy, and I'm going to actually show you a slide where there are many different levels of empathic responses. But there is primary level accurate empathy, which lets the client know that you understand what was explicitly expressed. That's kind of more like paraphrasing, perhaps, while maybe focused upon feelings, since we're talking about empathy. Whereas advanced accurate empathy is where the worker comments on what the client has implied and is left unstated, as well as that which has been expressed openly. And you may remember from an earlier talk, we talked a little bit about these empathic responses being pitched to the edge of the client's awareness, maybe pushing the bounds of what the client recognizes a little bit, but not going so far that the client can't relate to what you're saying and rejects altogether your response as being inaccurate. Through the reflection of feelings and paraphrasing of content, you can show and demonstrate an understanding very well with the client. And when you go beyond this explicit, it's always important to be sure that you make those statements tentative. So you might say, it seems to me that, or it sounds like, or let me check this out with you. Is it true that? Are you saying so on and so on? There are clients who do see empathy as intrusive, and so this is something you want to keep in mind. And some others actually are going to see it as attempts to control. Sometimes adolescents in particular worry about you having some capacity to read their minds. They've heard all sorts of things about therapists and everything, and can be very resistant of empathic responses because they don't understand what's going on and they're not used to it in their lives. I remember a boy at the residential treatment center where I worked in Florida, in Orlando, who was absolutely convinced that the staff psychologist was reading his mind. And it was just because the staff psychologist was just really good at empathic responses and yet really right on in terms of empathic responses. But that boy wasn't even at a point where he was recognizing the emotions he was experiencing. And so it was kind of threatening to him in a way. And there was a study back in the 70s, and I'm sure there are other studies since, that also show that nonverbal communications, eye contact, how your body is positioned, your distance from the other person, are also effective in communicating empathy. Genuineness or authenticity, congruence is another term again for it, refers to the extent that you are non-defensive, that you're real, and you're not phony in exchanges with the client. The capacity to communicate your experience with the client to the client is what this is about. And Rogers, you may have noticed, uses this quite a lot, and he believes that responding in a real sense is something that's very, very important in the therapeutic relationship, and that makes a lot of sense to me. That it does involve not hiding behind your professional role in order to protect yourself. It does suggest some measure of spontaneity, but weighing what is said only when needed and otherwise drawing on skills in a flexible way. Non-hostile, it's never aggressive in its exploration of the other person. Feelings, words, actions are all congruent, they're consistent with each other so that what you're saying matches your body language and your tone of voice. And it's also immediate in that this is really an opportunity for you to discuss aspects of the immediate exchange between you and the client in a way that will help the client understand themselves. That is a sort of a transactional analysis, basically, of what is going on in your relationship in the moment. Unconditional positive regard, acceptance, warmth, again, different terms that you can use, although I think there's a different meaning to each of those terms, but unconditional positive regard is the touchstone here. It implies genuine caring for the client without evaluation or judgment of the client's thoughts, feelings, or behaviors as either good or bad. It accepts and values the client for who they are, as they are, without any stipulation or expectation. And there's no need for the client to fear judgment or rejection in a relationship such as that. The existentialists, if you study humanistic psychology, they tell you that there are some theories that say that the problems, the emotional and mental illness issues that we have in our world relate to the fact that we don't experience unconditional positive regards in our relationship with significant others in our lives, particularly as children with our parents, that their love and respect and acceptance is at times based upon the child performing or acting in a certain way or being in a certain manner. And this is because of the fact that parents oftentimes wind up correcting children for doing things that they do, and they express displeasure with those things. The long and the short of it is that over time, in learning what is expected of them and learning to comply and conform to what parents and significant others in their lives look for in them, individuals will cut off parts of themselves and deny parts of themselves in order to please those important others. That is conditional positive regard. And so the corrective emotional experience in the therapeutic relationship providing unconditional positive regard is fairly obvious, I think. This requires that the therapist genuinely cares about the client, even if the therapist himself or herself disapproves of an action of the client, and to still maintain a positive attitude to the client. That doesn't mean that the therapist endorses behaviors of clients that are harmful to others, say, for instance, a child molester, and yet that the therapist can still work with that person and view that person positively and maintain a positive attitude about the client while not necessarily approving of the behavior that individual engaged in. This supports the client and the client's beliefs in themselves and encourages engagement and connection with the therapist. Making use of unconditional positive regard is an approach that recognizes the inbuilt tendency of human beings towards self-actualization. It adopts a positive view of human psychology that accepts our human innate desire to grow and engage in a meaningful self-exploration of feelings, beliefs, and behaviors. It facilitates the client in the growth process and empowers them to face current and future challenges. So empathy involves the worker's ability to accurately and sensitively perceive the feelings of the client and effectively communicate his or her understanding of those feelings. In order to do that, the social worker needs to have an awareness of the spectrum of human emotions and to be able to verbalize those emotions that are recognized to be experienced by clients. Conveying empathy accurately helps to influence the clients and fosters their growth. And there are a lot of different uses for empathic communication as implied here in the list, including it's useful in establishing relationships with the clients and staying in touch with them throughout the therapeutic process. It is useful in assessing client problems, of course, in responding to clients' nonverbal messages. It's useful in making confrontations more palatable. This is one way that a confrontation still can be supportive, even if it is confrontive, through the use of empathy in the confrontation process. It can help clients handle obstacles it can help us handle obstacles that are presented by clients. It can help managing anger and patterns of violence, and is also something that can really facilitate group discussions quite a bit. There are many different levels of empathic communication, and we're not going to be able to go into them in any kind of effective manner, but suffice to say that if you're interested in developing empathy, look for ways to learn more about it. And here's an example of 6 different levels of empathic responses that essentially starts with the kinds of responses we often have with involuntary clients, which is judgmental and confrontation, and ends with the highest level of empathic responding, where the worker is able to respond to a full range and intensity of superficial and underlying feelings and content. And this is something that isn't often found in any worker-client communication, even with the experts. And there's a whole tier of different kinds of levels of responses, as you can see here as well. It's worth your while in practicing empathic responses to keep the scale handy and perhaps work to increase the level of your ability to respond empathically. We also talked a little bit about additive empathy, and I wanted to just touch on this. Again, this is not something that we can train you on in this class or such a short lecture here. But here you can see several examples of additive empathy and interpretation, identifying deeper feelings that the clients aren't expressing that can really assist them in becoming aware of emotions that kind of are out there on the edge of their awareness. Identifying underlying meanings to the feelings, thoughts, and behaviors that are expressed to help the client to see what motivates those feelings and thoughts. Helping the client identify wants and goals that are implied but not fully recognized or expressed. Identifying deeper feelings that help the client to become aware of the emotions that lie again on the edge of awareness. Identifying implied feelings, ones that underlie surface emotions, adding intensity to feelings, identifying nonverbal communications. Your sigh tells me you don't feel good about it. It's an example of that. And underlying meanings of feelings, thoughts, and behaviors help the client see what motivates those feelings and thoughts and to discern patterns in those areas would be very useful in motivational interviewing. These are things that are useful to learn more about and to develop your skills in. Authenticity, the sharing of self by relating in a natural, sincere, spontaneous, open, and genuine manner, may or may not involve self-disclosure. But self-disclosure, of course, is the conscious and intentional revealing of information about oneself through verbal expressions and nonverbals and so on. So self-disclosure can be about you talking about what your experiences of yourself, but it also can be involved in somehow your nonverbal communication as well. And its use should be guided by the perception of whether it's going to be helpful to the client. That's the bottom line. Is it something that will help the client, that the client can make use of? Avoid sharing too many personal feelings and experiences until a rapport and trust have been established with the client. And here again are some examples of self-disclosure, self-involving statements, and personal self-disclosure messages. There are some cues sometimes for when one wants to respond with authentic responses, those stimulated by clients' messages that request self-disclosure. Again, depends upon the appropriateness of that, such as the worker's opinions, personal questions of the worker, and so on. And also those initiated by the social worker about past experiences, sharing the worker's reaction what the client is experiencing, expressing discomfort or experiencing discomfort and expressing it about the client's behaviors and so on. Nonverbal behaviors often reflect status differences, and there are some considerations that we should pay attention to. And for one thing, keeping gender socialization patterns in mind, the difference. For instance, in Western society, women smile more and tend to be more polite and more accommodating than in other cultures. Be sure your nonverbal and verbal behaviors are congruent. That's a part of that genuineness and congruence we were just talking about. Be aware of your facial expressions and what you convey. Gaze and gaze avoidance. And this is something that, again, varies from culture to culture. In our culture, looking at another person adds emphasis to speech, but that's not the case in many other cultures. And while it may be seen as a sign of respect and attentiveness in our culture, in other cultures it is seen as disrespectful. Posture, position, proximity, your gestures, it's important to know the meaning of those things and ethnic and regional significance. Touch, it depends very much on the situation and the relationship and roles, the meanings of that. I would say be very cautious, very, very cautious in touching a client. Very cautious. As I was told one time, even if a person has got their head on a table, crying their eyes out, and you go to touch their shoulders as an expression of sympathy, it can be misinterpreted. Physical appearance, the way you dress, the way you prepare yourself conveys a respect for the clients and it may keep it appropriate to your role. And always be familiar with cultural metaphors and modes of expression and modify your interviewing style as needed. That doesn't mean act like a 16-year-old when you're working with your teenagers. They don't want to appear in the interaction with you, but being aware of what is appropriate for them and what their expression means is something that can be very, very facilitative in your relationship with them. So we should monitor our interviewing style for our own idiosyncratic, counterproductive patterns of responding. Look for our own ineffective responses. And sometimes you can get feedback from others with that, but sometimes your clients will give it to you when you least expect it. But listening to audio tapes of your interviews, for instance, or videotapes, or even better still, video recordings, I guess, not tapes, or something that can be very, very useful. If you ever do that in any live interviewing interaction with a client, of course, you should have written permission by the client, and it should be very clear for the client who will see it and what it will be used for. But it can also be in simulation interviews and things like that. It's really interesting to watch yourself sometimes to see the little nervous habits that you have when you're talking to other people. Gauge your effectiveness of your responses through carefully observing how your client reacts to your responses, and then manage and modify ineffective responses of your clients at the same time. You can tell if your responses are off target, probably, if the clients reject the response or change the subject or ignore your message, seem to be confused by you or become more superficial instead of going into deeper things, argue or express anger. Probably a good clue that your responses are off target. But your response is probably helpful if the client continues to explore the problems, stays on topic, expresses pent-up emotions, engages in deeper self-exploration, volunteers additional information, and or affirms your response verbally or non-verbally. Just from watching how your client and listening to your client, how your client responds, it's going to tell you whether your own responses are effective or not. So that's just a summary of some of the main points about engaging clients and communicating effectively with them. So I hope that you found something useful here and a few extra reminders that might help you keep track of things as you continue in your studies this semester and in the years ahead. Thank you very much.